Child maltreatment is a global issue that creates a number of serious lifelong consequences. It is defined as the abuse and neglect that occurs to children under the age of 18 and includes emotional, physical exploitation, sexual abuse, neglect, negligence, and commercial exploitation. Child maltreatment has shown to have a negative impact on a child's cognitive and emotional development and can have lasting effects. Currently, paramedics are not required by law to report suspected child maltreatment, however, they will be protected to do so. The Ambulance Service Act 1991 states that an authorised ambulance officer may take reasonable measures to protect persons from danger or potential danger with an emergency situation. The Child Protection Act 1999 also states that a child has the right to be protected from harm or risk. While paramedics are not required by law to report suspected exploitation, officers will be protected if they were to do so by these acts.
According to the Australian Institute of Health and Welfare, in 2017 to 18, approximately 26,400 children ages 1 to 12 had one or more child protection notifications sustained. Child maltreatment can cause complications to both the individual's physical and mental health, resulting in increased risks of developing lifelong mental illnesses, substance abuse issues, as well as developmental withdrawal and social isolation, creating a magnitude of lifetime health costs and a significant burden on public health systems. This is further evidenced by the Australian Institute of Health and Welfare's 2018-19 report of young people under youth justice supervision and child protection, evidencing that 54% of children in Australia who had been involved with child protective systems have then come into contact with juvenile justice supervision and detention later in life. Child maltreatment has been directly linked to the development of depressive disorders, anxiety disorders, and self-inflicting injury, which in 2015 were responsible for 0.5% of deaths among Australian children and 2.2% of the burden of disease and injury. Combined with hospital visits for other injuries sustained during child abuse, it is estimated that the total lifetime financial costs for child maltreatment in 2014 was $9.3 billion, with $176,437 per maltreated child. Even though paramedics are not mandated reporters in the cases of child maltreatment, knowledge of signs and symptoms as well as common presentations of neglected children must be taught vigorously to ensure a second line of defense in protecting the welfare of children. This deficit is evidenced by the death of 22-month-old Mason Jet Lee in June 2016. When months prior, paramedics had visited the home for an untreated spiral fracture of the tibia with other graphic injuries sustained clear to signs of neglect. However, no formal reports were made by QAS or the hospital.
As a professional working frequently with children, although not mandated by law, it is important for paramedics to report child abuse and neglect in Queensland under the Child Protection Act 1999. The patient may display physical and emotional signs which should be common for paramedics to encounter in the pre-hospital setting. These include vague or inconsistent explanations of injuries, unusual internal injuries, or a delayed response between the occurrence of the injury and seeking medical assistance. Emotional signs may include extreme emotional behaviour, high anxiety, or a lack of trust. The paramedic may refer to the Child Protection Guide recommended by the Queensland Government. As monitoring the child's well-being would not be applicable to paramedics, the incident must be either referred directly to a support service, Family and Child Connect, Intensive Family Support, Aboriginal and Torres Strait Islander Family Wellbeing Service, or to a regional intake service, Child Safety.
As discussed, paramedics are uniquely positioned to identify child maltreatment in the pre-hospital environment. In 2014 to 15 in Australia, more than 42,000 children were the victims of abuse, and this figure is likely to be underestimated as many clinicians may underreport child maltreatment. The Clinical Practice Manual outlines therapeutic standards of clinical practice for QAS paramedics, including systematically developed information adapted from the best available evidence. What the CPM does not outline are guidelines for recognising child maltreatment and taking the necessary steps to report it. Lynn describes how additional adequate training in child maltreatment recognition improves reporting rates. Our strategy to improve on the recognition and reporting of child maltreatment is putting up a poster at all local QAS stations and adding this document to the CPGs within the QAS CPM.
The poster we have created is designed to educate paramedics and pre-hospital professionals on how to recognise and report any child maltreatment that they may come across. This includes looking out for the risk factors and signs of child maltreatment and knowing what action to take. It is important to note that if any of these signs or risk factors are present, further assessment is required before notifying. The goal of the poster is to increase the reliability of child maltreatment notification from paramedics and pre-hospital professionals, because it could save a life.
Due to their primary access to homes and first-hand experiences with children and families, pre-hospital professionals have the unique opportunity to recognise and respond accordingly to the signs of child maltreatment. However, there is a significant lack of reporting seen by many paramedics. This is mainly due to a lack of knowledge surrounding the indicators of child maltreatment and the correct ways to respond. Therefore, implementing an effective and educational visual approach will aim to improve the rates of reporting and subsequently reduce the harmful consequences of child abuse. A poster that is positioned in the ambulance or around the station is intended to improve paramedics' confidence and knowledge. It is suggested that many health professionals' confidence improves directly after an education session, but then will decline over time. So the use of a visual tool which can be accessed and utilized at any time allows for long-term retention of the information. Posters are also relatively inexpensive to produce and will add great value to furthering paramedics' ability to deliver potentially life-saving care for children in need.
As outlined in the Registered Health Practitioners Code of Conduct, paramedics have a responsibility to retain their alertness regarding children who may be at risk of abuse or neglect. They also have a duty of care to notify the appropriate child protection authorities in adherence with the relevant state's law. While this duty of care can provide a justification for reporting, the clinical practice manual provided for QAS employees does not outline the relevant signs and steps to take if maltreatment is identified, therefore reducing the likelihood of a practitioner reporting recognised abuse. This knowledge gap can effectively and efficiently be minimised by the visual training prompt outlining the risk factors and signs that could otherwise go unnoticed by first responder personnel. Training, in this case delivered via the visual cue, can improve the confidence and ability of the paramedic to identify and report the maltreatment.